Hey everyone, welcome back to my channel. I am your new VSG to bypass revision bestie. My name is Diane and I talk about everything good, bad, and in between for going through these experiences. I've been there, done that, and I'm currently going through a few things. So about my most recent hospital stay, as you can see, I'm in the hospital. I had my revision done on the 28th, about a little over 2 weeks ago, and about exactly 2 weeks later, I got a UTI. And so, which was very painful, but I went to urgent care immediately as soon as I realized what was going on, which was like within 24 hours. Got my medication, my antibiotics, got something for pain, and I thought, hey, everything is fine. About 2 days later, I was in excruciating gastric pain, like pain I've never felt before. Never experienced it, didn't even know what was going on. I felt like, okay, did I do something wrong? Really like blaming myself for everything, like putting myself down and just trying to figure out what the heck is going on. It was just extremely painful and very unusual for what I was dealing with. And so the next morning, went to urgent care. They said, you know what, because you just had your revision done, your bypass done, and you had a UTI, we need you to go to the emergency room because we can't do a CT scan and they really need to see what is going on inside. So they sent me to the emergency room. I got there, they did a CT scan, and they said, wow, it looks like you have a bowel obstruction. You're going to be admitted. So then I was admitted to my hospital where my surgeons and my medical team is. They ran some CT scans, had me drink contrast, did x-rays, and a whole slew of things. And then my doctor, Dr. Montgomery, awesome doctor. He's amazing. If you're in the Jacksonville area, if you're looking to have like VSG done, bypass, or revision done, look up Dr. Montgomery with North Florida Surgeons at St. Vincent's. They are top notch. I mean, he's amazing, wonderful. And so after reviewing everything, Dr. Montgomery gave me a stronger antibiotic to help treat the UTI. And looking at everything, they're like, okay, it doesn't look like I actually have an obstruction, a bowel obstruction. It looks like I have an ileus. And so if you look at my previous video, I explained what an ileus is, but let me just go through it real quick. An ileus is not something that is exclusive to someone who has had gastric surgery, okay? Or exclusive to someone that has like bypass surgery or anything like that related to the bowels and the gut. It is not exclusive to just weight loss surgery. It can happen to anyone who has had something traumatic happen to their body. For example, anytime you go under the knife, that is trauma happening to your body, right? So traumatic event, surgical event, like my revision to bypass, and then having an infection, my UTI 2 weeks later. So what happens is those two things that happen, two major things that happen is like your body, think of it like a computer. It is on overload. It's like, okay, I'm going to focus on what's most important, which is healing the trauma of the surgery and the UTI to get better. And what happens is your bowels, your intestines, the way it moves things down like a wave. Think of like a wave. It's like moving like that, like fluttering and moving and contracting to get everything down, absorbed through your large and small intestines and all that. And then to eventually to get it out. It went dormant. It clocked out. It didn't want nothing to do with me or anything I had going on. And so that's what happened. Those muscles just stopped. It just stopped working. Just like that, because my body is on overload. And then also some things that can also contribute to that happening is like dehydration too. So like if you just had surgery, you're feeling great, about 2 weeks, 3 weeks, you're working out, maybe light workout, maybe you're not getting as much fluid as you need to get into your body too, or nutrients, because we get busy, we work, we forget, we could do our best, but we're human, okay? All these things can contribute to you getting an ileus. And so thankfully, it has been able to start resolving itself because of the stronger antibiotic and because I caught it early enough. So as soon as I start to feel that symptom, those signs and symptoms of like nausea, vomiting, severe gastric pain, I wasn't able to pass gas, I wasn't able to defecate, poop, things like that. Feeling extremely weak. All those things are signs and symptoms of, let's say, an obstruction or something happening with your intestines and your bowels or whatever. Because I'm the type of person, if something starts happening, I'm not going to wait 2-3 days. I'm immediately going to my doctor, urgent care, or emergency room, because one thing I've learned in my experience in life and navigating the healthcare system as a professional and as a patient, usually when people just wait and keep waiting, they usually have a worse outcome. And so because I was able to advocate for myself and do what I needed to do, it didn't have to get to where I had like an actual bowel obstruction, which could have occurred if I just left it alone, didn't seek treatment, and it wouldn't have started to resolve itself. And so I'm very thankful for the team here at St. Vincent's. I'm thankful for Dr. Montgomery, thankful for Avicenna and Baptist, all the places I've been to these past few days to help me get to this point where I wouldn't have to have like surgery to remove like part of my intestines, or I wouldn't have to have like a tube put down my throat to suction out whatever's sitting in my stomach or bowels, okay? Because that's what could occur. And so for a few days, I was NPO, which means nothing by mouth. So I couldn't eat or drink anything. And the reason for that is because you need to give your intestines, your bowels, your gastric intestinal system time to just rest. Okay, so they need to just rest. They don't need to be working right now. And so we don't want to activate anything going on. So I was just on strictly IV fluids. Dr. Montgomery prescribed me a bag of multivitamins that I got through IV, the stronger antibiotic, taking my gabapentin for like nerves and things like that because of surgery, for nausea. And something I learned, because I started to get migraines, and apparently that's one of the signs and symptoms too when you're having some kind of like gastric or bowel issue. It can trigger migraines. And so I started to have like really bad migraines, and that's one of the things that you can pay attention to as well. So yeah, that is what's going on. I was able to finally have a bowel movement late last night. It was a little painful, but it was okay. And then today, again, I was able to have a bowel movement. So I'm very thankful for that. And so hopefully I will be able to go home either tonight or tomorrow. Depends on how I tolerate things. Dr. Montgomery moved me to having like soft foods, so that way to get my system working again, but just taking it easy and just kind of seeing how I tolerate it. I'm still taking like nausea medicine because I still feel pretty nauseous. There's the Triptan for my migraines, which is a medication for like migraines and things like that. Still getting the antibiotic. Moving around, I was able to just move around, walk around, and I'm not having as much pain as I was having before. So I'm super thankful for that. If this video has helped you out, please like, subscribe, and share. Bye. Let me know if you've ever had this happen to you before, or if you have any questions or concerns. I don't want to scare you away from having gastric surgery. It has changed my life for the better. But I just want you to be informed about what you can expect and what to pay attention to and how to seek treatment, and then how to learn how to advocate for yourself. Those are the things that are really important to me when communicating with you guys. So have a blessed day. Love you. Until next time. Bye.